Hello and welcome to episode 1 of Science and News, which is my new weekly series where I discuss different scientific research. It's mostly going to be medicine related, health related, as of the nature of the channel, I am about to enter medical school. Hopefully, I'm applying right now. I have a bachelor's in science, in neuroscience. So today we're going to be looking at Zyns, we're going to be looking at Ons and Velo, and all the different nicotine pouches. Also compare that to traditional cigarettes. I'll even look at roll your own cigarettes. And I'm going to compare all the different types of tobacco, the role of nicotine in those different types of tobacco, and maybe having preventative effects, helping prevent dementia. And I'm gonna break it down more. I'm not necessarily siding one way or another on the pouches yet, so you have to stay tuned for the slideshow presentation. So let's jump into that. Science and News, episode 1. We'll be discussing, do nicotine pouches reduce the risk of dementia? But before we do that, let's discuss what nicotine is. I'll give everyone a second to try to give the IUPAC name of nicotine, which is right here. This is a methyl group. We've got some cyclic nitrogen groups. Whatever. You probably can't get it. I can't either, because that's crazy. You won't need to know that for any organic chemistry course or for the MCAT or anything like that. But it is 1-methyl, 2-pyridinyl pyridine. I don't even know if I said that right. And basically the way it works is it binds to nicotine receptors and causes them to release neurotransmitters. In this case, it's releasing dopamine and activating the receiving neuron. But before I talk about whether nicotine actually is going to decrease your risk of getting dementia, I want to look at different types of research, because a lot of people don't think in this way. They say, this study shows this, or this study proves this, when in reality, not all studies are created equal. And a lot of times, if you want to make a broad claim, you're not going to want to look at one study, because sometimes studies have conflicting findings. Some things will say, yes, this suggests one thing, and another study will say, no, it suggests something completely different. Which is why, at the top of the pyramid, we have the meta-analysis, which combines data from multiple studies to produce a single, stronger estimate of the overall effect. And then below that is a systematic review, which is a comprehensive summary of all relevant studies on a topic, and it uses predefined methods to try to minimize bias. And then you have randomized controlled trials, which participants are randomly assigned to a treatment or control group to test the effect of an intervention. Cohort study follows a group of people over time to see how exposure to a factor influences outcomes. And then you have case control studies, which compares people with the disease to those without the disease. The people with the disease are the cases, and the people without it are the controls. And the purpose of that is to identify risk factors. And then you have case series/case report, which describes the outcome of one patient. That would be a case report. Or a small group, which would be a case study. And then you have people that are just experts giving their opinions, or there's background information relevant to the topic at the bottom of the pyramid. And you really want to, before making broad claims, look at all these things and avoid saying that this proves something, because science is an iterative process. So studies rarely prove something. More often they'll suggest something, or they'll push you in a certain direction, and that might change over time. So keep that in mind as we're going through the studies that are coming up, and think critically. I want to bring up the case of Accutane as an example of why you should think critically, because early on when Accutane was first introduced, people thought it might be causing depression, because a lot of people that took Accutane were at higher risk of suicide and depression. But later, people thought about it critically, and they were like, well, a lot of these people are adolescents or teens struggling with depression already, and that might be related to the fact that they have acne that's extreme, and the problems that could cause in their social life, and other things, confidence. So they're predisposed to depression. The people that are taking Accutane are predisposed to depression already, and once they controlled for that, they realized, in fact, Accutane does not cause depression. And whenever you're looking at something like this, you want to consider the mechanism behind the effect you're looking at. How could Accutane be causing depression? Of course, when you're dealing with things that are complicated, like psychiatric conditions, it's more difficult to identify a mechanism. But you still want to be thinking that way. as you'll want to do in the case of the analysis of dementia and nicotine pouches. Also, originally people thought that smoking cigarettes reduces your risk of dementia, which we now know is not the case, because a lot of people that were smoking cigarettes were dying before they reached the age where they're at the highest risk of developing dementia from cancer, from heart disease, which actually is a more prominent risk than cancer. A lot more people that smoke cigarettes will develop will develop heart disease or have heart attacks, more so than people will get cancer, which is interesting. So, I bring this up also because science is not a religion. A lot of people have these yard signs that are like, we believe in science. Look, science is critical by its very nature, and it's actually very anti-science to say that we believe in it fully. You want to approach science with a critical mind, without preconceived notions, and when you recognize you have a bias, you want to be even more critical when you're looking at things that might support your preconceived notions. So if you're coming into this video and you're saying, "Oh yeah, I totally think that nicotine probably, is going to give protective effects against dementia," maybe look more for evidence against your opinion. Okay, let's look at the post hoc fallacy, which relates directly to the Accutane case. Because in the case of Accutane, people thought, well, because people are taking Accutane and many of them are committing suicide or being treated for depression, Accutane probably causes depression. And that is the post hoc fallacy, which is the assumption that because one event preceded another event, they must be causally related. And the example I have here, a man crosses at a red light and gets a headache, and then he thinks crossing at red lights causes headaches, which is pretty clearly not the case, if you're thinking about this specific example. But in other cases, it might not be so clear, like in the case of Accutane, or in other cases. So think about the mechanism behind the effect. Why is this effect happening? Like, what specifically is causing it? Because, as has famously been said by a lot of other people, correlation does not mean causation. So, now let's look at the specific researchers that have done research on nicotine. So we have Paul Newhouse. He's an MD over at Vanderbilt University. He's done a bunch of research about nicotine. And then Kenneth Keller, I've got one study by him I'm going to talk about, less related to dementia, but still interesting. So, the Paul Newhouse studies, we got the MIND study, and I'll summarize it really quickly, but I would encourage you to read it before developing your opinions, and also to recognize that it's not like a meta-analysis, it's a one-off study. So, take it with what you will. Don't say it proves anything. If you come away from this video with one thing, come away with this. Individual studies don't prove something to be true. They may suggest it's true, but you're going to want to have further research and look at a lot of studies before you say anything close to it proves it. It suggests it. So, this study, summary, it involved 74 non-smoking individuals with an MCI who were randomized to either receive a 15 milligram per day transdermal nicotine patch or a placebo for 6 months, and the results indicated that nicotine led to significant improvements in attention, memory, and psychomotor speed with no serious side effects reported. Interesting, it might suggest some cognitive benefits of nicotine. Doesn't necessarily relate to dementia, but the memory improvement study is a large-scale 2-year clinical testing period where daily transdermal nicotine suggests that it might improve memory and function in those with an MCI. So those are a couple studies, you can check them out, read them yourself. And this is interesting, okay? So this is Kenneth Keller looking at how nicotine exposure might increase or modulate, your reward pathways. This is done in mice, and it looks at ethanol consumption. But think about adolescence. Human adolescence. A lot of people vape or use just nicotine pouches. So might modulate your reward pathways. Also, I want to point out in the other studies I talked about, these were patches, not pouches. Keep all these factors in mind. So maybe nicotine does not necessarily prevent dementia. I mean, I would say there's no strong evidence to suggest that, because first of all the studies that have been done in that area are mostly on people with pre-existing conditions, whether they have an MCI. Which, look, I know, now that I'm looking back at the slideshow I prepared, I actually did not include the studies on people with like dementia and Alzheimer's in my slideshow. I just had people with an MCI. But those studies, it's a little bit mixed effects still. Some of those people have improved attention and that sort of stuff, but um, it's not definitive. So what are some actual benefits of nicotine pouches? Well, I've got this figure on the left here, looking at cigarette smoke. So what actually happens when you inhale cigarette smoke is you absorb the nicotine, but also carbon monoxide and free radicals into the bloodstream through the alveoli, which are in the lungs. And once it gets into the bloodstream, it impacts the epithelial cells, which line your blood vessels, and it injures it, basically. So it impairs its ability to regulate blood flow to some extent, it triggers chronic inflammation, and it attracts immune cells. So you can see the alveolar macrophages in this diagram, some lymphocytes, and basically, the longer term effects, it leads to some diseases, emphysema, chronic bronchitis, these sorts of things, and that's caused by the cigarette smoke itself, causing scarring uh, in the epithelial cells, and it causes arterial stiffening, uh, thrombosis from the cigarette smoke itself, from the free radicals, from the carbon monoxide. And you avoid that when you have just a nicotine pouch where you're absorbing only nicotine, theoretically. I'm sure there's other stuff with the flavoring and that sort of thing that gets absorbed into your bloodstream as well, but it's certainly not carbon monoxide and free radicals. But what effect does that have on hypertension and inflammation? Clearly, when you have free radicals and carbon monoxide, that's going to cause a lot more clear long-term hypertension and arterial stiffening than maybe nicotine pouches. So there's some nuance here, and there's another study that I'm going to have in the description that talks about using nicotine as a treatment for a bunch of different inflammatory diseases. In some cases, nicotine has an anti-inflammatory effect, and in other cases, it has a pro-inflammatory effect, depending on the cells in question. So nicotine acts on a ton of different cells. A lot of people just think about neurons, but of course, nicotine plays a role in muscle contractions, and it's on all sorts of other types of cells. So in this paper, people are looking at maybe using nicotine as a treatment to help reduce inflammation and when not to use it. As far as I can tell, the arterial effects and the effects on your blood vessels of nicotine are more transient. It's going to activate your sympathetic nervous system and everything that comes with that. Your blood pressure will go up. You'll have your heart rate will increase because your sympathetic nervous system is getting activated. But does it cause the same scarring and the same stuff as cigarette smoke? I don't think so. So it's clear. I mean, I think everyone, for the most part, recognizes that nicotine pouches are less harmful than cigarette smoke. But long term, if you keep activating your sympathetic nervous system, is the nicotine going to cause long term stiffening? I don't know. I don't think we've really done enough research to say that. This quote has been pretty prevalent. People smoke for the nicotine and die from the tar or from the free radicals and carbon monoxide. So, take this what you will, and please don't say that one study proves something. This is my first episode of Science in the News. And if you want to follow me on my journey to becoming a doctor, click the buttons below the video. If you want to tune in for future episodes of Science in the News, stay tuned. I'm going to be posting a video every Friday. This is the first one. So I did all my research yesterday and today when I had the idea. It was a little rushed. And in the future, hopefully I'll have better studies, better researched and prepared videos. So stay tuned for that. Hopefully eventually we'll turn it into a live stream.